Warning: never eat almonds if you have these 3 common conditions. Doctors rarely warn seniors. Most people call almonds a superfood, but if you're over 55, there are 3 common health situations where almonds can do more harm than good. We'll explain exactly why, what to watch for, and safe swaps you can use instead, so you can protect your health without giving up taste. If this message matters to you, take a moment now to subscribe for science-backed senior nutrition tips. First, a quick clarification. Some expert sources point to 5 categories of concern tied to almonds. For this video, we're focusing on 3 primary conditions that are especially relevant to older adults: kidney stones, thyroid dysfunction, and autoimmune disorders. We'll briefly cover the other 2 important cautions, nut allergies and certain digestive conditions, after the main 3. Remember, not everyone needs to avoid almonds, but if you have any of these issues, almonds may increase your risk or make symptom control harder. Talk to your doctor or a registered dietitian before changing your diet or stopping any medication. 1. Kidney stones. Why almonds can add fuel to the fire. Meet Martha, 68. She eats a handful of almonds every afternoon with her tea. Over 3 years, she had repeated kidney stone episodes and finally learned that her daily almond habit was adding a steady supply of oxalates to her system. Oxalates are tiny plant molecules found in many vegetables, nuts, and grains. When they bind to calcium in the urinary tract, they can form hard crystals, calcium oxalate stones, that are painfully passed or require medical treatment. As we age, kidney function can decline slightly, and many seniors are more likely to be dehydrated or take medications that affect renal handling of minerals. That combination raises the chance that a sustained high oxalate intake can tip the balance toward stone formation. Almonds are among the higher oxalate nuts, and almond-based products, almond flour, almond milk, protein bars, and many keto baked goods, can quietly add up a lot of oxalate across the day. How this works in plain language: imagine oxalates as tiny grains of sand. When you drink enough water, those grains pass harmlessly, but if there's not enough fluid or there's too much sand coming in, those grains can clump and form a pebble, and sometimes a stone. The kidneys try to filter oxalates, but repeated exposure can increase the chance that crystals form. Red flags to watch for: sudden severe pain in your side or lower back, flank pain, pain that radiates to the groin, blood in the urine, frequent urge to urinate, fever with pain which can indicate infection. If you have a history of calcium oxalate stones or recurrent kidney stones, almonds and almond-containing foods may increase your risk and are best avoided unless your nephrologist or dietitian supervises an individualized plan.
Practical steps you can take right now. Avoid whole almonds and almond-derived products if you've had calcium oxalate stones. Read ingredient labels carefully. Almond flour, almond milk, almond butter, and many snack bars contain concentrated almond. Increase fluid intake to keep urine dilute. Discuss specific fluid goals with your clinician, and work with a kidney specialist or dietitian to evaluate total dietary oxalate. Choose lower oxalate alternatives for snacking. Macadamia nuts are relatively low in oxalate, as are pecans and some seeds like pumpkin seeds and sunflower seeds in moderate amounts. Keep in mind allergies and overall fat content when choosing swaps. If you're using almond milk regularly, try oat milk or low oxalate dairy or plant alternatives after checking with your provider. 2. Thyroid dysfunction. Why almonds deserve caution if your thyroid is fragile. John, 72, was diagnosed with Hashimoto's thyroiditis years ago and takes levothyroxine each morning. He enjoys almonds because they feel like a healthy snack, but he's noticed persistent fatigue and brain fog despite treatment. Some nutrients and plant compounds can influence thyroid function indirectly. Almonds contain phytates, some goitrogen-type compounds, and are a source of polyunsaturated fats, PUFAs. Phytates can bind minerals such as zinc and iron, minerals the thyroid needs to make hormones. Certain plant compounds can interfere slightly with iodine uptake or the thyroid's ability to use iodine, especially when iodine intake is marginal. And dietary fat composition, including high amounts of some PUFAs, may affect how the body converts the storage thyroid hormone, T4, into the active form, T3. This is not to say almonds cause hypothyroidism. Instead, for people with existing thyroid disease, Hashimoto's, hypothyroidism, or documented iodine deficiency, almonds may contribute to factors that make thyroid control more difficult. For older adults, who often have slower metabolism and multiple medications, small nutritional interferences can be meaningful. What to look for: persistent or worsening fatigue, unexplained weight gain, sensitivity to cold, swelling in the neck, constipation, memory or concentration problems, or symptoms that don't align with your usual treatment response. If you take thyroid medication such as levothyroxine, be aware that certain foods and supplements can affect absorption if they're consumed too close to the dose. Do not stop or alter your medication. Instead, discuss any dietary concerns and medication timing with your prescribing clinician. Practical guidance: if you have diagnosed hypothyroidism or autoimmune thyroid disease, consider minimizing almond intake while you and your endocrinologist or dietitian monitor thyroid function. Check ingredient lists for hidden almond content, and discuss whether you should trial reducing almonds for a few weeks to see if symptoms and lab values improve.
For safe swaps, consider nuts that are lower in phytates and richer in omega-3s to help balance inflammation. Walnuts provide alpha-linolenic acid, plant omega-3, and can be part of a balanced approach if tolerated. Macadamia nuts and pecans are lower in phytates compared with almonds. Also, ensure adequate iodine, zinc, and selenium as advised by a clinician or dietitian, because correcting deficiencies matters more than removing a single food group. 3. Autoimmune disorders, when almonds may aggravate inflammation or gut sensitivity. Ellen, 66, has rheumatoid arthritis and has noticed joint flares and more gut discomfort when she eats a rash of nut-heavy snack mixes. For people living with autoimmune disease, two concerns often arise with certain plant foods: lectins and an unfavorable omega-6 to omega-3 ratio. Lectins are proteins found in many plants that can bind to the gut lining. In a sensitive gut, especially when intestinal permeability or leaky gut exists, lectins may irritate the lining and, in susceptible people, contribute to immune activation. Almonds also contain significant amounts of omega-6 fats. While omega-6 fats are not inherently bad, an imbalance favoring omega-6 over omega-3 can promote inflammatory pathways in people already prone to immune overactivity. Again, this is not a universal verdict. Many people with autoimmune conditions tolerate almonds fine, but if you have a history of autoimmune flares, inflammatory joint pain, unexplained fatigue tied to food, or gut-related immune symptoms, almonds could be a contributor to symptom persistence. What to watch for: a noticeable increase in joint pain, morning stiffness, swelling, new or worsening digestive symptoms after eating almonds, bloating, cramps, loose stools, or a pattern where flares follow nut-heavy meals. If these patterns exist, consider an elimination trial under supervision, removing almonds for several weeks while tracking symptoms, and then reintroducing them to see if symptoms recur. This needs to be done with clinical oversight to avoid nutritional gaps. Practical takeaways: avoid almonds during active flares or until you and your clinician determine whether almonds are a trigger. Replace almonds with options lower in lectins and with a better omega-3 profile. Macadamia nuts and pecans are lower lectin choices for many people. Seeds such as chia and flax are excellent for adding omega-3s. Pumpkin seeds and sunflower seeds can be good options for crunchy snacks. Boost dietary omega-3s with fatty fish, walnuts, chia, or a clinician-recommended supplement to help balance inflammation. Keep a food symptom journal so you and your provider can identify patterns rather than guessing. Also important to know, 2 other cautions the research and clinical guides mention. First, nut allergies. This is a medical emergency for anyone who develops it. If you have a known tree nut allergy, you must avoid almonds and almond products entirely. Signs of a severe allergic reaction, anaphylaxis, include throat tightness, difficulty breathing, swelling of the face or tongue, sudden drop in blood pressure, dizziness, or loss of consciousness. Seek emergency care immediately if these occur. Do not assume mild past tolerance guarantees future safety. Allergies can develop at any age. Second, digestive disorders such as IBS, Crohn's disease, and other inflammatory bowel conditions. Some people with sensitive guts find almonds trigger bloating, gas, or cramps. Processing methods like soaking, blanching, or grinding reduce some starches and enzyme inhibitors, but won't reliably remove all lectins or phytates, so those techniques are not a guaranteed solution for a sensitive gut. If you have significant digestive disease, talk with your gastroenterologist or dietitian about whether almonds should be limited or avoided. Benefits of almonds, a balance note for those who tolerate them. Almonds can deliver meaningful benefits when they're tolerated and used in moderation. For people without the 3 flagged conditions, here are 5 concise benefits and why they matter. Brain support. Almonds are a good source of vitamin E and monounsaturated fats, nutrients associated with protecting brain cell membranes and supporting cognitive health. Skin and tissue repair. Vitamin E and healthy fats in almonds support skin integrity and may help with tissue repair and moisture retention. Sleep and relaxation. Almonds supply magnesium and the amino acid tryptophan, which can support calmness and healthy sleep cycles in some people. Red blood cell and energy support. Almonds contain riboflavin and trace minerals that participate in energy metabolism and overall cellular function. Muscle recovery and circulation. Magnesium and arginine in almonds support muscle relaxation and blood vessel health, useful for active seniors who need recovery nutrients. For older adults who tolerate almonds, a general guideline is moderate intake. Roughly 1 ounce per day, about a small handful, is a common recommendation in nutrition guidance. Treat this as a general guideline, not a prescription, and adapt it to your health context. Hidden sources and label reading. What to watch for. Almonds don't only appear as whole nuts. If you're advised to avoid almonds, check these common sources: almond milk, almond flour or meal, almond-based protein powders, many keto or paleo-friendly baked goods, almond butter, snack bars, granola clusters, some salad dressings, confectionery coatings, and gluten-free mixes. Food labels sometimes list tree nuts without specifying which one. When in doubt, contact the manufacturer or avoid the item. If you prepare foods at home, be
Beware cross-contamination when shared kitchen tools or oil are used. Safe alternatives. 4 practical swaps and trade-offs.
If almonds aren't a good choice for you, here are reliable alternatives and what to consider with each. Macadamia nuts. Low in oxalate, lower phytate content for some people, high in monounsaturated fats. Good crunchy swap, but calorie-dense, so watch portion size. Pecans. Relatively low oxalate and rich in healthy fats. Good texture for baking or snacking. Still a tree nut, so avoid if you have a tree nut allergy. Pumpkin seeds and sunflower seeds. Seed options are lower in some of the compounds of concern and make a great snack or salad topper. Check for added salt or flavorings. Walnuts. Higher in plant omega-3 ALA, which can help balance inflammation. Walnuts taste different from almonds, but are a heart-healthy swap for many people. Note, walnuts can be slightly higher in polyunsaturated fats, so keep portions moderate. Other options include roasted chickpeas, if tolerated, sliced bananas or apple with a thin spread of tahini, or dairy or soy-based yogurt topped with low oxalate seeds. Always consider allergy history. Seeds may cross-react with nut allergies in some people, so check with an allergist if you have a severe nut allergy. Practical daily strategies for seniors who are unsure. If you're not certain whether almonds are a problem for you, try these steps with your healthcare team. Keep a food symptom journal for 2 to 4 weeks. Note what you eat, portion sizes, and any symptoms that follow. Patterns often reveal triggers. Discuss lab testing and medical history with your clinician. If you've had kidney stones, autoimmune flares, or thyroid instability, your provider can help design a monitored elimination trial or suggest specific tests. If you have kidney stone history, request a metabolic stone evaluation through your nephrologist or urologist to identify the type of stones and targeted dietary changes. For thyroid patients on levothyroxine or other medications, ask your prescriber whether food timing matters and whether any dietary changes could affect absorption or dosing decisions. Never adjust medication yourself. If you have an autoimmune condition, consult a rheumatologist or immunologist and a registered dietitian experienced with autoimmune-friendly diets before starting long elimination trials to avoid unnecessary nutrient gaps. Wherever applicable, increase omega-3 intake and consider reducing processed food and excess seed oils that can amplify omega-6 intake. Soaking, roasting, and processing. Do these make almonds safe? Soaking and roasting can change texture, reduce some enzyme inhibitors, and make almonds easier to digest for some people, but these methods do not reliably remove oxalates, phytates, leptins, or the fatty acid profile. Soaking alone is not a medical remedy for the clinical risks discussed here. If you have one of the 3 conditions, processing methods should not be relied upon as a safety measure. Avoidance or medical supervision is the prudent choice.
When to seek medical attention. If you experience signs of kidney stones, severe flank pain, blood in the urine, severe allergic reactions, difficulty breathing, throat tightness, swelling, lightheadedness, or any new or worrying symptoms after eating almonds, seek medical attention promptly. For allergic emergencies, call emergency services immediately. For persistent but less acute symptoms, worsening joint pain, chronic fatigue, or digestive flares, schedule an appointment with your primary care physician, gastroenterologist, nephrologist, or endocrinologist as appropriate. A practical example plan for someone with uncertainty. If you're 65, generally healthy, but you've had 1 kidney stone 10 years ago, and you enjoy a handful of almonds daily, a reasonable path is check in with your kidney doctor for a stone risk assessment, track your fluid intake and urinary symptoms, and consider swapping almond snacks for macadamias or pumpkin seeds until you get a professional evaluation. If you have Hashimoto's and feel your symptoms are unstable, talk with your endocrinologist about whether an almond reduction trial would be useful while monitoring TSH, free T4, and free T3 as recommended. If you have an autoimmune condition, collaborate with your care team to decide whether a supervised elimination diet may help identify triggers. Final balanced recommendations. Almonds can be a nutritious food for many people, offering vitamin E, healthy fats, magnesium, and other nutrients, but they are not universally safe. For seniors with a history of calcium oxalate kidney stones, thyroid dysfunction, or autoimmune disease, almonds may increase risks or make symptom control harder. If you fall into one of those categories, the safest next step is to avoid almonds or significantly reduce intake until you've had a clinical evaluation and, if appropriate, a supervised elimination trial. If you don't have these conditions, moderate intake, around 1 ounce per day, is a reasonable guideline, but remain attentive to how your body responds. This video is for informational purposes only and is not medical advice. Talk to your doctor or a registered dietitian before making diet changes. If this information helped you, or if almonds have caused problems for someone you care for, share your experience in the comments. Your story may help another senior avoid a painful episode. If you found this useful, please like and subscribe so we can keep sharing practical, evidence-minded tips for aging well.